Welcome to Living Fuel TV. I'm Casey Craichy. Have you ever had pain? Are you walking around in pain right now? Do you frequently twist your ankles? Have you been told you need shoulder surgery? Today, I'm excited to have special guest Dr. Patrick Purdue. Dr. Purdue, excited to have you.
Glad to be here.
Today, I want to discuss something that I've known about for, 10 years. And maybe I think it might have been, I don't know how many years ago that you first actually did this procedure on my left knee when I strained it playing basketball.
4 or 5 years ago, maybe.
It might have been more. I don't know. But so prolotherapy. Prolotherapy is now it's really kind of mainstream, but it's unheard of. So people don't know what they're doing. What I'm trying to say is that prolotherapy is a therapy that is recognized now by a lot of people in the conventional streams of medicine, but really not known much about by patients. Would you agree with that?
Yes, and in actual fact, prolotherapy is really a conventional technique that is non-toxic. It began somewhere around the 1930s or so. Some researchers like Dr. Hemwall and Dr. Hackett did a lot of research where they proved that chronic TMJ joint pain could be 100% reversed, repaired by the injection of non-toxic solutions that cause the body to generate its own fresh new tissue around ligaments and tendons to rebuild the joint. And they chose the term prolotherapy as a contraction of the words proliferation therapy, because you're proliferating new cells in the area, basically.
So is this, as I understand it, you antagonize an area to the point where it draws the body's healing mechanisms, which probably is some sort of stem cell, drawing stem cells to the area to heal. That's
exactly what it does.
And bring it, because we've done some shows here on umbilical cord stem cell therapy and also re-injecting one's own stem cells, for pretty miraculous results. And so, go ahead.
I'm sorry. Well, we all have stem cells floating around the bloodstream all the time for lots of different tissue types. So, for instance, women who are going through problems with osteopenia or osteoporosis are familiar with the fact that they need to build up their bone stem cells, osteoblasts. Anytime you hear the word blast or the suffix blast on the end of a name, that means it's a stem cell. It makes more like itself. So in our bloodstream, we have fibroblasts. Those are cells that rebuild ligaments and tendons and connective tissue. And so in the process of an injury where, let's say an athlete twists a knee and there might be some torn meniscal material inside the knee, well, that's connective tissue, and if we can make the body migrate those fibroblasts, those stem cells, into that area, it will naturally repair itself without surgical intervention. And prolotherapy does that precisely.
I've experienced that with you in the past on my knee and then also on my shoulder. And so I'm convinced it's a therapy that people ought to consider, particularly those that are going in or have now to the point where they've said, I'm going to have surgery. So we have a lot of athletes, professional athletes and college athletes and so on, and weekend athletes watching the show right now. So how would they find out more about prolotherapy as an alternative? Because you've talked about repairing the triple labrum tear. Correct?
Yeah, I've done that bilaterally. One case, 3 labral tears on the right shoulder and 2 on the left, and we went after both shoulders and had it fixed in about 5 to 6 treatments.
And over what period of time?
They're done every 2 weeks. Treatment's done 2 weeks apart because we need 10 to 14 days for the body to put in a new layer of tissue.
Okay, so what types of injuries or pains should someone consider this approach? Is it any time that they're considering surgery as an alternative?
I would certainly investigate prolotherapy first because so many advantages to this as an alternative to surgery. One being, we're actually using the body's own natural process to repair itself. Secondly, there's no surgical recovery time with prolotherapy. Yes, it's a little uncomfortable because you're injecting and going rather deep into tissue, but an hour or two later, it's like no big deal. And so you can go about your day, go about your week, and have your normal activity level. If there's a downside to prolotherapy at all, it's that you've got to have the patience to wait it out for a couple of months or maybe 3 months as your body slowly puts in new tissue, slowly repairs. But I would argue that that's not so bad, because anyone who's gone through surgery will tell you, it took me a good year to get to the point where I felt normal again.
Right. And so like an ACL minor tear or MCL minor tear, what is the time frames you've seen for recovery where people are back on the field? Or
sometimes we have miraculous recoveries where one treatment is enough to get a person back in excellent condition.
That's what happened with my knee many years ago.
Yeah, exactly. And one of my daughters had injured her back doing ballet, and same thing, one treatment, and she was 100% within 2 weeks, ready to go again. But that's the less common experience. I always tell people, I don't expect any big changes or anything particularly noticeable after 3 treatments. And I would say that probably for severely injured areas, an average of 6 to 8 treatments is what my experience has been. Only twice in the 8 to 10 years I've been doing prolotherapy have I gone beyond that. 3 times. 2 of them took 16 treatments. But in those cases, we were talking about enormous injury. In both cases, these patients were off of disability and back doing their thing after 16 treatments.
It really is miraculous. What is it? I want to first say that I do not think that the injection pain is significant by any measure. I mean, some people are afraid of acupuncture needles, and you can't even feel them for the most part. So I want to say that, you said it's uncomfortable. Yeah, it's uncomfortable. It's not like taking a warm bath, but
right.
It's really not excruciating pain by any means. What is it that you're injecting in?
It's a mixture. The main driving force in prolotherapy is dextrose, sugar water. And we usually add a local anesthetic to it. The injection of sugar water into ligaments and tendons causes intentional inflammation in the area that you inject. Why do we want inflammation? Well, because...
It's a signaling mechanism.
Exactly. That's your body's natural signaling system to bring those fibroblasts, those stem cells, into the area, which is why, by the way, anti-inflammatory medications don't work long-term, because they stop the inflammatory process in the body. Therefore, you shut off the natural repair process.
Very interesting. So where can they find out more about prolotherapy? Is it on your site?
I don't have it on my site, but Googling prolotherapy will give you more information than you'll have time in your life to read. There's a fellow by the name of Dr. Ross Hauser, Hauser, in Chicago, who is a big promoter of prolotherapy, and he has references for around the country. So if you happen to be living in Washington State, for instance, you can find someone living close to you that you can talk to.
Terrific. Well, we're going to post some information on prolotherapy on our site next to this video, and people can do we'll short circuit the research like we try to do, so that we'll put the good stuff out there where people can go right to it. So
fabulous.
So it'll be there for you. We hope you enjoyed it. Consider prolotherapy in a situation where you feel pain in a joint or loose ligaments or re-injured ankles or something along those lines. But anyway, we sure hope you enjoyed it. God bless you, and have a great day.